bariatric surgery, as we have already spoken, is primarily a surgery for the treatment of obesity. Interestingly, significant number of patients who have diabetes, the diabetes completely goes away. Surprising? Yes. This was what happened about 25 years back when bariatric surgery was done in very big numbers in the United States and Europe. When they started looking back at the patients who have had a bariatric for weight loss, almost 80 to 90% of patients had their diabetes that went away. I mean, surgeons were surprised, wow, we didn't operate for diabetes, but then how is the diabetes going away? Then this last 20-25 years of research into this, how is this possible? How is this diabetes that improved has shown us that the bariatric surgery changes certain hormones in our intestines or in our body that improves the efficiency of insulin that is produced in our body. I know I'm making it complicated. Let's try to look back of what is diabetes. First of all, when you eat a sugar or a sweet or whatever be it, your food goes to the intestines. This food stimulates certain hormones in our intestines called incretins. These hormones work on the pancreas to produce insulin. We all have heard of the word insulin, which is produced from the pancreas. This insulin works at the cells level to push the sugars inside. So the food goes to the intestine, incretins are produced, which stimulates more insulin. Insulin pushes the sugars into the cells. So there is a normal sugar level in our blood. But now in this process, if anything is abnormal, the blood sugar rises. Let's say if that incretin is not produced properly, or if the insulin is not produced properly, or if the insulin is not able to work at the cell level properly, what happens is sugar levels increase. So this is what happens in a diabetic patient. What happens when the food reaches the intestines, the incretins which produces and tells the insulin to happen, it does not working well in diabetic patients. Because of this, the insulin is not produced well. Third, the insulin's effect on the cell level is also not happening well. This is called insulin resistance. Post bariatric surgery, because we are modulating the intestinal function, what happens? The incretins now increase. Because the incretins increase, insulin production is now better, and also the efficiency of insulin, in medical terms what we call insulin sensitivity, also improves. So without the need of any tablets, the glycomet, XMet, metformin, the various tablets that the diabetic patients take, without the need for insulin that is injected, by just modulating this, we can make the sugar levels come back to normal without the need for any of these medications. But every patient is not the same. We as doctors or specialists in this surgery will evaluate the patients to look at where the problem is, and appropriately, if you can do the surgery, diabetes can be completely cured. This is not a random statement that I make, but the American Diabetology Association, the world's biggest diabetic association, have defined this. They have got together, they have looked into all this, they have understood the various scientific publications, and this word diabetes cure was coined by the diabetologists from the US, supported by the International Diabetic Federation, which is all diabetic societies come together, and they have clearly defined diabetes is curable, and by doing the right surgery, we can help somebody get rid of their diabetes completely. This is now possible, and it has already been done in hundreds of numbers. And I personally have done my PhD. I am the only PhD in diabetic surgery or bariatric surgery in the whole of the Asia, where I have studied this on our Indian patients, how by doing a surgery diabetes can be cured. And yes, it is possible even for patients who are not obese, even for patients who are thinner but having uncontrolled diabetes in spite of medications. Now diabetes can be brought to normalcy, but this needs to be studied properly and done right. You just come, oh yeah, come, let's operate. It's not like that. So when done right, diabetes is curable.